same token, what do you think is the most positive thing about providers that give the services to the loved ones?
Without exception, they are a very unique group of people, which is kind of a contradictory statement, because if you're without exception unique, then I guess you're all the same. No, they are extremely committed, and they've chosen a very noble career path that isn't the most, in most cases, the highest paying career path, but it's one that provides the most return on their personal investment, and I just have a profound respect for that. But I think that that's probably, regardless of what service you're providing, if you've chosen this field, you've chosen to go into a field that's under-recognized, underpaid, but greatly needed.
Yeah, I agree, exactly. And you recently said you would like to expand the CDC Plus program. Can you tell me more about the CDC Plus program and why you feel the program will help people?
Well, it's the Consumer Directed Care Plus program, and it started out as a pilot. It's recently been made an official permanent program by the federal and state government. And the reason I would like to expand it because that's where we have seen the highest consumer satisfaction outcomes, because it allows consumers to purchase their own services. Consumers are given a budget, and then they're able to manage their budget and find providers on their own and buy the services. And it's been proven that they can actually find the services or buy them less expensively than they can through the traditional waiver, paying what our established rates are. We did a comparison of the most used services and what we pay for them on the waiver and what people in Consumer Directed Care Plus pay for them, and we across the board pay less for services. And because families can buy the services themselves and they can actually employ family members to provide the services, it really gives them a network of providers that they are most comfortable with. So it's not for everyone. Not everyone can manage a budget, so I don't think it should replace the waiver, but I do think that a lot of families could do really well with Consumer Directed Care Plus, and especially now that we're looking at implementing tiers, it's going to be that much more important for families to really be able to choose what they want independently.
And it kind of gives them an option.
Yeah.
And you also said at the Unity Conference in Tampa that if all stakeholders involved didn't suggest some positive changes, the changes would be imposed upon us. And you were right. And I see this happening. What do you think the worst case scenario could be for future change?
Well, superlatives are always hard for me. I don't know what the worst would be, but I think one scenario would be for this program to be prematurely dumped into a managed care paradigm, because not enough homework has been done. No state has ever implemented a managed care program for developmental disabilities successfully. So Florida should not go out and be a guinea pig in this area because it's not been proven to be successful. Unlike fee-for-service programs where you purchase services when you need them, like when you're sick or when an incident happens, the developmental disability population has pretty static, constant needs. So there's no spikes in utilization that allow a managed care entity to profit. Because a profit in a managed care setup comes when people aren't using the service. Someone like me, I've used managed care my entire adult life. I don't have anything against managed care in principle. I think it's a wonderful model. I've received great health care. My family has received great health care. But as an example, because of this past year, I have not been to a doctor since I don't remember the last time I was able to go to a doctor's appointment because I haven't had time. So my managed care company has made a lot of money off of me.
Or services that you aren't using.
My premiums have been paid every month, but I'm not using the service. And and my family is generally healthy, except my kids have had athletic, sports accidents or things like that. So we are a profitable managed care beneficiary. You don't really find profitable people in the DD field because the needs are daily, and they're not going to go away. People aren't sick, and they're not going to get better, and they're not going to come out of the hospital. So I think that there are people who believe that managed care is something of a panacea for state governments because it allows a state to contract out its responsibility and obligation to a certain group of people to a company, and basically you give them all the money and say, okay, you fix the problem, and they capitate a rate, they take about a substantial amount of profit off the top, and I just hate to be so blunt, but I just don't think it's the right answer for this program. And I feel really confident, though, after meeting with the governor staff just this week that that's not a direction that Governor Crisp wants to see this program go in. He recognizes that it has not been done successfully. He's looked at a lot of healthcare issues this year. He's very committed to making sure that people who are needy get healthcare. His healthcare for the uninsured, his Cover Florida program passed this year in the legislature. So it's not that he doesn't realize the needs, but he also realizes that this is a different kind of population with different needs. So I'm hoping that with his support, we'll be able to hold off the pressure that we're feeling, especially in the Senate, to move in that direction.
And it seems that you became the director of APD at a rough time when so many cuts had to be made. Was that hard for you to make the choices that you had to make and had to be done?
It was painful. It was extremely painful. It was excruciating. It was like being in the dentist chair every single day for 365 days. But it was difficult, but at the same time, it was so necessary because, and actually I didn't have a lot of choices. The legislature pretty much told us what we had to do. They dictated in Senate Bill 1124 what services had to go away, what services had to be reduced, and the tiers and the other changes that we had to make. So it was painful because I knew it was really causing concern and fear among families. But it was one of those things that I knew if we didn't do it, we would never get out of the deficit that we were in. We were in a $153 million deficit, and we're looking at finishing out this fiscal year with about a $10 million deficit, which in the world of Health and Human Services budgets, that's really negligible. That's not something that you get become alarmed over. So we've made huge progress. Unfortunately, we've made it on the backs of families and providers, but they've been incredibly stoic and resilient, and they're all there still providing the services and hanging in there. But it has been difficult.
And what have you liked most about being the director of the Agency for Persons with Disability?
The people. I work with an amazing group of people. They've taught me so much, almost as much as the families have taught me, and the providers. It's just, this is a great field to be part of. I told my staff when I announced my resignation that I made the mistake of falling in love with them, with the people we serve. It's gets into your heart.
Oh yeah, well, caring is part of it. And can you tell me some positive changes that have been made to the APD program since you took over your position?
Well, a lot of internal improvements have been made that aren't very exciting or sexy to talk about, but they have made things better. We've codified a lot. We had a lot of regulations and rules that were floating around but have never been formalized. So we've done a lot of that, just tightening up internal policies and complying with some legislative mandates that we had never complied with in the past. Tightening down our policies on the waiting list and not taking people out of line off the waiting list. Moving the CDC Plus program in-house, that had been contracted out to an outside provider. We actually went through 4 providers, and all 4 experiences were horrible. So the program was just really not well run. And so we made the decision over the winter to bring it in-house and manage the fiscal part of it on our own. We've been doing that for several months now, and I still get emails from families thanking us. It's completely turned that program around, and people are getting their paychecks on time, and they're able to log their timesheets on the web, which is they used to have to fax them in. So that's a huge improvement. We've implemented a newsletter, and I think we've engaged the stakeholders community much more actively. So, and of course, bringing in the fiscal controls so that we could get out of our deficit, and then just doing a better job of managing our budget forecast so that we have credibility with the legislature. Part of the agency's problem a year ago was that we didn't have any credibility because every time we presented information, it was different, and they felt that we didn't track our budget accurately. And I had the good fortune of being able to hire Jim DeBogren as our Deputy Director of Budget and Planning. He came from the House of Representatives, and he's been a guru in that area and brings with him 19 years of credibility with the legislature. His brother-in-law has a developmental disability who receives services through our waiver, so his heart is in it for the right reasons, and he's done a great job of turning our budget shop around.
Well, that's good.